Historical evolution of nursing research. Period of intuitive nursing and medieval period. Nursing was untaught, uninstinctive, and only it was performed based on compassion of others out of wish to help others. And nursing was a function that belonged to woman. It was viewed as a natural nurturing job for woman, and she is expected to take good care of the children, the sick, and the aged people. And no caregiving training is evident. It was based on experience and only by observation. Primitive men believed that illness was caused by the invasion of the victim's body of evil spirit, and they believed that medicine man Saman and with the doctor, which doctor had the power to heal by using only by magic, some hypnosis, charms, dancers, incantation, purgatives, massage, fire, water, and herbs as a mean of driving illness from the victim. Trephining, drilling a hole in the skull with a rock or stone without anesthesia, was a last resort to drive evil spirit from the body of the afflicted. Period of apprentice nursing, Middle Ages. In this time, care was done by crusaders, prisoners, religious orders, and nursing care was performed without any formal education, and the people who were directed by more experienced nurses. This kind of nursing was developed by religious orders of the Christian church. And this is the time the nursing went to lowest level. The wrath, anger of Protestantism confiscated properties of hospitals and many schools connected with Roman Catholicism. And nurses fled their lives. Soon there was shortage of people to care for the sick, and hundreds of hospitals closed. There was no provision for the sick. No one is there to take care of the sick people. And nursing became the work of the least desirable of women, prostitutes, alcoholics, and prisoners. And Pastor Theodor Fielder and his wife Frederica established the Kaiserwerth Institute for the training of deaconesses. This is the first formal training school for nurses in Germany. And this was where Florence Nightingale received her 3-month course of study in nursing. Period of educated nursing, Nightingale era, 19th-20th century. The development of nursing during this period was strongly influenced by trends resulting from wars, ceremony, civil war, arousal of social consciousness, and increased educational opportunities offered to women. And Florence Nightingale was asked by Sir Sidney Herbert of the British War Department to recruit female nurses to provide care for the sick and injured people at the Ceremon War. And in the year 1960, the Nightingale Training School of Nurses opened at St. Thomas Hospital in London. And this school served as a model for other training schools, and this whatever the graduates, those are getting graduated from the schools, they were traveled to other countries to manage hospitals and institute nursing training program. And the Nightingale focused mainly on her vision of was more on developing the profession within hospitals, and nurses should be taught in hospitals associated with the medical schools, and that the curriculum should include both theory and practice. It was the first school of nursing that provided both theory-based knowledge and clinical skill. And nursing evolved, that's the definition we usually say, that it's nursing is an art and science. And formal education and nursing services began. Milestones of nursing research in Western countries. 1950, there was an increase in federal funding for research in nursing. American Nursing Foundation was devoted exclusively to the promotion of research in nursing. And in the year 1952, for the first time, there was publication of nursing research. And in the year 1953, the Institute of Research and Service in Nursing Education was launched at Columbia University. And in the year 1955, American Nurses Association established American Nurses Foundation as an independent organization for the purpose of development of nursing research by conducting and supporting research projects. And in 1957, a Department of Nursing Research was established at Walter Reed Army Institute. And in the year 1960, it brought reordering of nursing research. And in the year 1965, the American Nurses Association took an official position in educational preparation of licensed nurses, in which the need for research to improve the quality of patient. And in the year 1970, a content analysis of articles published in nursing research from 1970 to 1975 showed a shift from research in nursing being conducted by a large group of members of other disciplines, especially social sciences. And in the year 1976, the American Nurses Association Commission on Nursing Research published guidelines for the academic preparation of nurses in participation in research and its utilization. And in 1986, the National Center for Nursing Research was established at National Institute of Health under the Health Research Extension Act 1985. And in the year 1990, brought the promise of reducing the gap between practice and research. And in the year 1993, National Center for Nursing Research was renamed the National Institute of Nursing Research. And in the year 1994, the journal Qualitative Research started being published. And in the year 1995, an international evidence-based practice collaboration was established in Australia. And in the year 1997, Canadian Health Services Research Foundation was established with federal funding. And in the year 1999, US Agency for Healthcare Policy and Research was renamed as Agency for Healthcare Research and Quality. And 2000, NINR issued funding priorities for 2000 to 2004. Annual funding exceeds $100 million. And 2004, the journal World Views on Evidence-Based Nursing started being published. And 2005, Sigma Theta Tau International issued a position paper on nursing research priorities that incorporated priorities from nursing organizations internationally. Coming to the development of nursing research in India. In 1946, Boer Committee submitted a report in which recommendations were made for the improvement of various aspects of nursing profession, nursing education, nursing research, working conditions, nursing services in both hospitals and community, sending nurses for higher education to abroad. And in the year 1953, Miss Edith Bachchan, Vice Principal, Rajkumari Amrit Kaur, College of Nursing, New Delhi, was the first nurse from India who was sent to Columbia University to earn her doctorate in education under WHO. And in the year 1955, Miss Margareta Krag, Principal, College of Nursing, New Delhi, attended International Council of Nurses meet in France to present a paper on the need for nursing research in India. And in the year 1960, first 2 years master degree program in nursing started by RAK College of Nursing, New Delhi. And in the year 1963, a study of health services was carried out in connection with the revision of syllabus of general nursing and midwifery by the Indian Nursing Council. And in the year 1964, Dr. Mary Ferguson, a public health nurse who joined RAK College of Nursing, New Delhi, was able to create greater appreciation and understanding and value of the research in nursing for nursing practitioners, administration and education. And in the 1966, Trained Nurses Association of India established a research section under the guidance of chairwoman Miss Margareta Krag. And in 1971, again, Trained Nurses Association of India conducted a study on the socio-economic status of nurses in India. And in the year 1976, Dr. Mary Farrell and Dr. Aparna Baduri of RAK College of Nursing, New Delhi, conducted seminars on nursing research for educationalists at Delhi, Missouri and Yercaud in Tamil Nadu. And in the year 1981, Dr. Farrell and Dr. Baduri's book, Health Research, a community-based approach, was published by WHO. And in the year 1982, a national conference titled Nursing Research in India, Prospect and Retrospect was organized, which was the first conference in India related to nursing research and was held at College of Nursing, Bangalore. And in 1984, a nursing research workshop was conducted titled Teaching Nursing Research to Nursing College Teachers at Bangalore, which was sponsored by the University Grant Commission. In 1986, the Nursing Research Society of India was established to promote research within and related to nursing. And in the year 1998, Nursing Research Intersection was organized under the chairmanship of Mr. R. Rajaratnam, Senior Nursing Tutor in Immense. And in the year 2002, only revised syllabus of INC for GNM post-basic has included nursing research as a full subject. In 2004, publication of Nightingale Nursing Times was started by Jain and Co. in Noida. And in 2005, National Consortium PhD Nursing has been constituted by Indian Nursing Council under the leadership of Sri T. Dilip Kumar, President INC, New Delhi. And in the year 2007, Nursing Research Society of India has launched its official journal titled Journal of Nursing Research, Society of India at College of Nursing, Vidyapeeth, deemed University Pune on 23rd February 2007. And in 2009, Central Institute of Nursing and Research was brought in existence under control of TNA. And 2009 only IGNOU started PhD in nursing. And 2010, Baba Farid University of Health Sciences, Farao, Punjab started PhD in nursing. 2011, publication of several nursing scholarly journals started in India, such as Kerala Nursing Forum, Indian Journal of Nursing Studies. And in the year 2012, Nursing Research Society of India has started an initiative to create database of thesis abstract for the nursing research conducted by the nurses during their postgraduate and doctoral level nursing education. And in the year 2013, Ministry of Health and Family Welfare, Government of India constituted an expert advisory committee of nursing education and research to work. Facts about Florence Nightingale. She is the mother of modern nursing, lady with the lamp, because of her achievements in improving the standards for the care of war casualties in the Syrian war. And she was born in 1800 in Florence, Italy, raised in England in an atmosphere of culture and affluence. And she is not connected with the social custom imposed upon her as a Victorian lady. And she developed her self-appointed goal to change the profile of nursing. And she compiled notes of her visits to hospitals and her observations of the sanitary facilities, social problems of the places she visited. The need for preventive medicine and God nursing, advocated for care of those afflicted with the diseases caused by lack of hygienic practices. At the age 31, she entered the deaconess school at Kaiserworth in spite of her family's resistance to her ambitions. She became a nurse over the objections of society and her family, and she was worked as a superintendent for Gentlewomen Hospital, a charity hospital for ill governors, and disapproved the restrictions on admission of patients and considered this unchristian and incompatible with healthcare. And she has upgraded the practice of nursing and made nursing an honorable profession for women, and led nurses that took care of the wounded during the Syrian war. And she has put down her ideas in two published books, Noted on Nursing, What It Is and What It Is Not, and Notes on Hospitals. And she revolutionized the public perception of nursing, not the image of doctors, handmaiden, and the method for educating nurses. Period of contemporary nursing, 20th century. This is the time the licensure of nurses started, specialization of hospitals and diagnosis, training of nurses in diploma program, development of bachelorate and advanced degree programs, scientific and technological development as well as social changes marks this period. Health is perceived as a fundamental human right. Nursing involved in community health, technological advances, disposable supplies and equipments, and expanded role of nurses was developed. WHO was established by the United Nations, and aerospace nursing was developed. And use of atomic energies for medical diagnosis, treatment, and computers were utilized for data collection, teaching, diagnosis, inventory, payrolls, record keeping and billing, and use of sophisticated equipments for diagnosis and therapy. So many advanced equipments has been introduced during this period. Thank you.